We begin tonight with news from our #1 industry, as the Ministry of Tourism is on course for another reopening of the country's borders, instituting new protocols as figures continue to rise globally. Officials led by the Minister of Tourism held a press conference today outlining the measures put in place to limit the number of new COVID-19 cases imported into the country while protecting Bahamians and visitors alike. Cleopatra Murphy leads us off tonight.
The Bahamas will remove the mandatory 14-day quarantine when the country reopens on Sunday. Minister of Tourism and Aviation, the Honorable Dionisio Diagler, addressed the newly established protocols during a press conference Saturday.
I repeat, effective tomorrow, Sunday, the 1st of November 2020, the Bahamas will be removing the mandatory 14-day quarantine as promised, and the emergency orders will be revised to reflect that change.
Diagler also announced that officials have scrapped plans that would have required tourists to take a rapid antigen test upon arrival at the airport, sharing that because of the country's many ports of entry, logistics would have posed a challenge. Instead, he says tourists will be required to take that test 5 days later. As the quarantine is eliminated, so is the need to enroll in the Hubcat monitoring system.
The use of rapid antigen tests as an effective screening tool at the border was not supported by the available research, or as some would like to say, was not supported by the science. As a result, effective tomorrow, the 1st of November 2020, there will be no tests conducted on arrival.
Travelers are still required to have a negative RT-PCR COVID-19 test taken within 5 days before arrival, in addition to a Bahamas Health travel visa from travel.gov.bs, with the exception of children under 10 and pilots and crew of commercial airlines that overnight. This is as global COVID-19 cases continue to climb, as the U.S. broke a daily world record on Friday, recording 99,321 new cases of COVID-19. The Minister of Tourism says protocols are intended to protect the health and safety of tourists and Bahamians with a more methodical and comprehensive process.
As of tomorrow, November the 1st, travelers will be required to pay an application fee for their travel health visa. Additionally, as of November the 14th, all visitors to the Bahamas will be required to purchase COVID-19 health insurance before they come to the Bahamas. The cost of this mandatory health insurance will be automatically included in the total cost of the health visa. The inclusion of the travel health visa is to ensure that any visitor who may test positive for the coronavirus while on vacation in the Bahamas or become ill from the virus while in the Bahamas will not suddenly become a burden to an already overburdened Bahamian public health system. This insurance is not intended for Bahamians, as they will be returning home, and we expect them to avail themselves of our local healthcare providers and our local medical facilities in the usual manner.
Diagler says the insurance will be billed to the visitor through the cost of the travel health visa at a cost of $40 for citizens and returning residents, while visitors staying more than 4 nights will be charged $60. The minister says Atlantic Medical, now CG Atlantic, will be the supplier that will provide 3 options.
First, those who test positive but exhibit no symptoms, i.e. asymptomatic, can quarantine in place for up to 14 days. The insurance will cover the hotel costs of that quarantine. Second, if a person tests positive, exhibits no symptoms, asymptomatic, but has a pre-existing medical condition, then they will have the option to be medically evacuated out of the country. And third, if a person tests positive and exhibits symptoms, they will be immediately medically evacuated to their home country for medical purposes.
Cleopatra Murphy, ZNS Network News.